It's an 11th hour push to get legislation through the General Assembly that would help ease the financial burden for parents trying to conceive.
If it passes, couples would be able to have insurance cover genetic testing on their frozen embryos to determine if they have the potential for a healthy pregnancy. Fertility specialists call this a game changer. Opponents, though, say it's reflective of a bigger problem. 12 News reporter Erica Ritchie has both sides of this debate.
The legislation was spurned by a personal story. Most bills often are. This one, though, belongs to the legislator herself.
I had a pre-genetic condition.
Sandra Cano learned that during her first pregnancy with Ariana Hallel. That condition increased her risk of having a child with a disability. Little Ariana was born healthy, but Sandra wasn't taking any chances going forward.
If I expand a family, I would have been able to have a healthy baby.
So Sandra chose in vitro fertilization, allowing her to have the embryos genetically tested before they're implanted.
It allows you to not have to go through that anxiety.
Dr. Gary Frishman is a fertility specialist with Boston IVF, a local fertility center that has seen a 15% increase in patient treatment since the pandemic. Dr. Frishman says screening the embryo for chromosomal errors like Down syndrome or inheritable conditions like cystic fibrosis helps the couple make an informed decision.
Couples have the option to do with that embryo what they wish.
Freeze, implant, or discard, if they even get to that point.
The majority of women take their chances simply because they can't afford it.
Testing embryos is not covered by insurance in Rhode Island and can cost roughly $5,000.
Just to get it together, $4,000, and every egg that would be tested, it was $600 per egg.
Sandra's bills have been paid, but she wanted to make testing accessible to all. So as a senator, she filed legislation this session that would require health insurers to pay for embryonic genetic testing the same way they pay for diagnosis and treatment of infertility. The Senate passed it unanimously last month. It's now hung up in the House because of opposition from health insurance advocacy groups like AHIP, who testified that, quote, these bills will lead to higher premiums, harming affordability and access for small businesses and individual market consumers.
There's no free lunch, so if you add a little bit to premium here, you may be bumping somebody off health insurance here. Or if you add a little bit to premium here, you may be raising a deductible here.
We have to make sure that we don't allow something like this to stop people from wanting to start families or continue to grow their families.